Hi viewers, you're welcome to this episode of Sight Ed, a sight educational program that has been designed to enlighten every one of us on eye health issues. This edition today is going to be focusing on answering a couple of the questions that you have forwarded to us on our different social media platforms. And so I'm so excited today because we've enjoyed a volume of interactions with your questions. Some of them we've answered to personally, but we thought at this point we should be able to answer some questions that are general and that is going to be of benefit to all our viewers. And so today I'm going to be having two consultants or specialists, people who have had experience in handling all of the questions that have been asked. So with me today is Professor J.F.A. Owenye, who will be taking some of the questions. You're welcome, sir.
Thank you very much.
One person actually sent this question, and the question was, is it okay if I use members of my family's glasses or my friends?
Thank you very much. It's a very common question, and the truth is that the use of a pair of glasses should be individualized. A pair of glasses prescribed to someone should just be that individual's property. That is not to be shared with anybody else, regardless of the relationship between the wearer and this other person, either husband or wife or brother and sister. Because a slight difference in the prescription power for a particular person may make it difficult for this new person to be able to use this pair of glasses. So it's recommended that every individual who needs a pair of glasses should visit an eye clinic and have his or her eyes checked and his or her own pair of glasses prescribed.
Well, because some people just felt, if a wife needs a glass and her husband is using one, why not just say, honey, can I quickly use your glass? What if their prescription is the same?
Well, if the prescription is the same, it's a different thing. If the prescription is the same, that is if the two of them can ascertain that they are using the same prescription. Good. But if not, then a pair of glasses that belongs to someone else might not be useful to you. For instance, the one I'm putting on now, if I had to give you, there's no way you'll be able to say with it because it was individualized, personally, for my own error to be corrected.
Well, thank you very much. And one other key thing you have said now, which I wouldn't want the viewers to forget, is that each time you go to check your eyes for a pair of glasses, you're actually availing yourself the opportunity to have a thorough checkup on your eyes. The back of your eyes, are there other diseases there? Something that is lurking around that can quickly be attended to before it leads to blindness or some other serious disease or conditions. So we just want to appeal to every one of us, go get your eyes checked. If you need a pair of glasses, please go get your own to use at all times. Well, thank you very much, Professor J.F. Owenye. Something related to glasses, as I said, we've tried to pull the questions as much as possible together. It's the issue of roadside or on-the-counter glasses. And the person wanted to know, so what is the problem with these glasses? They appear cheap and I can still manage to read with them.
Well, I like that word, manage to read with them. In ophthalmic practice, we want an optimal use of whatever it is given to you, such that it will be able to serve you adequately well. Some of the roadside things that we get, they will only be for a temporary thing. I'm not sure anybody will have done a thorough examination as to the exact power that this individual needs. Even a slight error in fixing the lens into the frame properly is enough to make glasses not functional. So, apart from the fact that an individual who just bought a pair of glasses on the roadside might not really be sure that is even the correct power he or she needs. It could be lower, it could be higher than that individual needs. Such a person will only be able to momentarily use that pair of glasses. It may not serve that individual for a very long time. More so, it gives an opportunity for a thorough check of the eye, that for all you know, there is more to this individual just wearing a pair of glasses. it could be an opportunity for that individual to also have other things that could make someone blind detected early enough to be treated to prevent an avoidable blindness.
Okay. Thank you very much. So if I get a wrong pair of glasses, what happens?
If you
Let's say the power is too high and then I just picked it, I can see with it, but does it have any after effect?
The effect a wrong pair of glasses will have is that you will be uncomfortable as the user to be able to use it. I say that because some people have the belief if you pick a pair of glasses, your eye would be destroyed. Not destroyed in the sense that you become blind immediately, but a pair of glasses that is too high for you. For instance, if you are overcorrected, say you are a short-sighted person and you are overcorrected, instead of wearing a -3, you are given a -5 power. You will see, of course, with a -5, but you can only see for maybe 5-10 minutes before you start having headache. Headache. So you keep on wearing these glasses and headache will continue. That will not even abate with the use of any analgesics. It's because you've been overcorrected.
Okay, the next question, sir, is why do people commonly seem to catch Apollo? That is, once there's Apollo in an environment, before you know it, it's as if everybody is partaking in it.
Yes, Apollo is an infectious disease. Apollo infection, just like any other infection, demands something from us. That is personal hygiene. Hygiene, strict adherence to hygiene is enough to prevent a spread of an infection like Apollo. If you are going to instill an eye drop into the eye of someone who has an Apollo, it's advised that you wash your hands before and after installation of this medication. Someone with Apollo is with you in the house. You are not to use the same handkerchief with this individual. You are not to use the same towel with this individual. It should be personalized to that person as long as necessary. It is only through this means of shared handkerchiefs, shared towels, or after instilling medication into the eyes, you forgot to wash your hands. These are ways of inoculating yourself with the virus that can now cause an Apollo infection.
Thank you very much for that enlightening segment. And sometimes too, when someone that have Apollo or an infection, I've just opened the door by touching the handle of the door or some other surfaces, and then we get there and we touch on the same thing, and the next few minutes we're touching our eyes, and then
before you know it, the eye is red and bringing out all sorts of things.
Yeah, the other question we have here is, what is the problem when someone has watery eyes? You know, the eyes just seem to be watering all the time.
Yes. At times, a watery eye could be as a result of foreign body in the eye. Foreign body in the eye could bring out profuse watering of the eye. But again, it could also be a pointer to the fact that this individual has what is also called a dry eye disease, because of the layers that constitute the eye tear film. If the topmost layer is not there, it means that the rate at which the tears will be evaporating from the eye will be faster. In that process, through a reflex action, more aqueous part of the tears will be produced, and it will give an impression that you have watery eyes. Whereas what is happening is that the rate at which the tears is evaporating is so fast, and to compensate for that loss, more aqueous will now come out, and it will look like you are producing more tears. But the truth is that the eye is dry already because one of the layers of the tear film is deficient.
Right.
So that is causing a faster evaporation than necessary.
Okay, but let's add this quickly. If you have a watery eye, please go visit an eye hospital. Let you be properly checked. Let's know what is causing your watery eyes so that appropriate therapy or treatment can be given to you. Something related to watery eye. Some people, when they smile or chew, then water will just be coming.
Yeah, it happens. People who are chewing and there's something just so that the truth is that even under a normal condition, because the ability to smile, to laugh, and those things, they are normal emotional reactions. So you could have even tearing occurring. But we have instances where a nerve misdirection, because everything we do is under nervous stimulation. A nerve misdirection that's supposed to have just been for the glands secreting tears alone is also part of what we use in chewing. Such a thing can happen at times, and you may find an individual who, while chewing, tears is coming out of his or her eyes.
Wow, Professor, thank you very much. Is it the same thing as crocodile tears? I don't know.
Crocodile tears.
Oh, really? Okay, so don't bother. That's what we're being told. If you have a watery eye because of chewing, it may just be because there's some misdirected nerves. It's okay. Well, it's a pleasure having you today, and thank you for taking time out to answer some of these questions. We do hope we'll have you at another time.
Thank you very much.
You're welcome. Well, viewers, you're welcome back from the first segment of the questions and answers, and we want to thank sincerely Professor JFA Oweye for taking his time to explain and to teach us all those things that pertain to the questions that were asked. And also subsequently the short clip of a video that we just showed you, which is just a video of a cataract surgery. We showed that so that some of us can also understand based on the questions that we have here, that we don't necessarily remove the eye, but we're going to get back to that very soon. This is still your program, Sight Ed, a sight educational program designed to enlighten every one of us on eye health issue. I remain your host, Feyi Adepoju. And once again, thank you for all the questions and the comments that have been so impressive and helping us to improve this program. So again, I'm going to be asking Dr. Mrs. Olatunji Victoria. You're welcome, ma'am.
Thank you, Mrs.
All right. Yes, the first question we have here, someone said, if a father or a mother has glaucoma and his or her children are free of the disease, is it possible that their grandchildren can in the future develop glaucoma?
Okay. Thank you so much, presenter, for that question. Yes, it is possible for their children, that means the grandchildren, to have glaucoma. Because glaucoma is a disease that has been proven to have some genetic association. What do I mean by that? Is that it may run in families. So, and like other genetic diseases, glaucoma can skip a whole generation. It's possible that it skips that generation of the children and then reappears in the generation of their grandchildren or even great-grandchildren again.
Well, that will also explain the fact that sometimes when we have patients in the clinic diagnosed of glaucoma, and then they say, I don't have any family history of that kind of disease. My mother doesn't have glaucoma, my father doesn't have it. So I'm sure this explanation that have been given by Dr. Ms. Olatunji will help us to understand better that a particular generation may be skipped. That doesn't mean that subsequent generation may not have this disease. Well, the other question we have here, which is quite an interesting question, it says, when you say an eye is diseased and cannot be treated, can't you people transplant another eye to enable the person to see?
Thank you for that question. Yeah. It is not possible to transplant a whole new eye
normal.
Yes, back.
And it would be like you're just cleaning the windscreen when the engine of the car is faulty.
Exactly,
that car will not move anywhere.
Exactly so.
Well, thank you very much. The very last question that we have here. It's believed, it is said and is believed generally that during eye surgeries, the eyes are removed and you work on it and then you replace it back.
That's not true, presenter. We don't remove the eye and then try to place it back.
I didn't actually ask the question. Somebody asked this question.
I know. I'm
okay.
So we don't remove the eye and try to fix it back. What we do is just make an incision into the eye and then remove whatever it is that we want to remove. Then we'll suture the eye back, and that is all. Because if you remove the eye, it means you cannot fix it back. You remove the eye only when you think that eye is no longer of any good or is creating pain, is not seeing. That's the only time you remove the eye. Once you do that, you can't fix another one. However, we can just put in what we call the artificial eye after that.
Okay. And the artificial eyes do not see. All right. So in summary, you heard from not the horse's mouth, from the consultant ophthalmologist, that we don't remove the eye when we're doing surgery. And some of you actually believe that when we remove the eye and in the process of trying to put it back, if luck is not on our side or the gods are angry with us at that time, then we are not able to fix it back. It is not true. We don't remove the eyes because we want to operate or do any corrections on the eye. Well, thank you very much for your time. We quite appreciate all that you've done to ensure that every one of us has adequate knowledge about eye health issues. I want to believe the few number of questions we've been able to attend to have been so illuminating to you. I mean, their answers. We can't take all the questions, at least not in one episode. And as time goes on in the course of the program, we will still find some other episode where we can adequately respond to some of the questions that you're sending in. It's still your program, Sight Ed, a sight educational program designed to enlighten every one of us about eye health issues, preserving sight, restoring vision. See you next time.